Today our topic is on ankylosing spondylitis. Don't forget to subscribe. Ankylosing spondylitis is an inflammatory disease that can cause some of the vertebrae in your spine to fuse together. This fusing makes the spine less flexible and can result in a hunched forward posture. If ribs are affected, it may be difficult to breathe deeply. Ankylosing spondylitis affects men more often than women. Signs and symptoms of ankylosing spondylitis typically begin in early adulthood. Inflammation also can occur in other parts of your body, most commonly your eyes. There is no cure for ankylosing spondylitis, but treatments can decrease your pain and lessen your symptoms. Its symptoms are early signs and symptoms of ankylosing spondylitis may include pain and stiffness in your lower back and hips, especially in the morning and after periods of inactivity. Over time, symptoms may worsen, improve, or stop completely at irregular intervals. The areas most commonly affected are the joints between the base of your spine and your pelvis, the vertebra in your lower back, the places where your tendon and ligaments attach to bones, mainly in your spine but sometimes along the back of your heel, the cartilage between your breastbone and ribs, your hips and shoulder joints. Its causes. Ankylosing spondylitis has no known specific cause, though genetic factors seem to be involved. In particular, people who have a gene called HLA or B27 are at significantly increased risk of developing ankylosing spondylitis. Risk factors. Your sex. Men are more likely to develop ankylosing spondylitis than are women. Your age. Onset generally occurs in late adolescence or early adulthood. Your heredity. Most people who have ankylosing spondylitis have the HLA-B27 gene, but many people who have this gene never develop ankylosing spondylitis. Ankylosing for long time or in severe cases, its side effects are in severe cases of ankylosing spondylitis, new bone forms as part of the body attempt to heal. This new bone gradually bridges the gap between vertebra and eventually fuses sections of vertebra together. Those parts of your spine become stiff and flexible. Fusion can also stiffen your rib cage, restricting your lung capacity and function. Other complications may include eye inflammation, uveitis, one of the most common complications of the ankylosing spondylitis. Uveitis can cause repeat onset eye pain, sensitivity to light and blurred vision. See your doctor right away if you develop these complications or these symptoms. Compression fractures. Some people experience a thinning of their bones during the early stages of ankylosing spondylitis. Weakened vertebra may crumble, increasing the severity of your stoop posture. Vertebral fractures sometimes can damage the spinal cord and the nerves that pass through the spine. Heart problems. Ankylosing spondylitis can cause problems with your aorta, the largest artery in your body. The inflamed aorta can enlarge to the point that it distorts the shape of the aortic valve in the heart, which impairs its function. For the treatment, the goal of treatment is to relieve your pain and stiffness and prevent or delay complications and spinal deformity. Ankylosing spondylitis treatment is most successful before the disease causes irreversible damage to your joints. Lifestyle and home remedies. If you smoke, quiet smoking is generally bad for your health, but it creates additional problems for people with ankylosing spondylitis. Depending on the severity of your condition, ankylosing spondylitis can affect the mobility of your rib cage. Damaging your lungs by smoking can further compromise your ability to breathe. Stay happy and healthy.